Hi guys, okay, this is my second time making this video. The last video was 20 minutes. I was running off out the mouth, so I'm going to try to keep it 10 minutes, and I may leave out some things. So if I do leave out something and didn't answer everyone's question, please forgive me. Put your question in the comment section and I will be happy to answer it. Okay, so this video is about working in a nursing home versus working in a hospital. The only thing that's different is the amount of work. In the nursing home, for instance, sometimes we have to get up every resident for breakfast. That's if you're working at the night shift. I'm working night shift. I'm talking about the night shift. We have to get up almost all of our residents for breakfast, and that's very hard work trying to get up about 10 people within an hour or an hour and a half. Clean them, dress them, and brush their teeth, do all of that stuff within an hour, because most of the residents that are at the nursing home, they can't do for themselves. We have to do everything. So we are busting our butts in the morning, sweating and carrying on for a whole hour and a half, and trying to get all of this done before the next shift comes. So that's the only difference. No one has to get up in the morning. Everyone is not total care in the hospital. Most of the patients can do for themselves. We just provide them with the tools, we'll give them their, towels or blankets, whatever it is that they need. Give them water if they want coffee, whatever it is that they need. We give it to them. That's the only difference. And another thing is my back is not killing me at the end of my shift. My feet is. I had to get some comfy shoes. I was trying to avoid those nursing shoes because I really don't think they're cute, but they do have some cute nursing shoes. So I did have to buy that, because running and ripping on my feet for 12 hours is not cool. So my feet was throbbing, yes, but my back was not hurting. So I do have some comfy shoes now, because wearing sneakers on 12 hours is not the way. It's not the truth. It's not the life. Okay, so that's the only difference. So if you're going to plan on working in the hospital, get some comfy shoes. 12 hours on your feet is not cool. It's not like 12 hours. I mean, you can sit down at certain times, but your feet is going to kill you if you don't have the proper support. What else? Okay, so this is my day at the hospital. When I go get my assignment, I go get my report from the other CNA, and then as I'm getting my report, depending on if I'm doing it in the room or outside of the room, most likely outside of the room. But when all of that is finished, I go and introduce myself to all of the residents. They have a board in the room. I look at their board. If you hear crying, it's my cat. I look at the board and I see the status of the patient, if they are NPO, if they're full liquid diet, clear liquid diet, if they're on a healthy diet, if they need AccuCheck, if they have sugar diabetes. I assess all of that, and then while I'm in the room, I put my information on the board, because we're given these little phones that we use, and we use it for the patients to contact us and for us to contact the nurses or the unit secretary or whoever it is that we need to call each other. CNAs, we call each other if we need help on the little phone, so we don't have to run down or chase anyone. My cat. What I was telling you. Okay, so while I'm in the room, I'm writing down my information and I'm introducing myself to the patient, asking them at that time if they need anything, if they want any water, because we do have to pass out waters. And instead of me filling up the cart with a whole bunch of waters, because most of them don't want waters anyway, and most of them can't have waters because they're NPO or something like that, I will see what they need, and then I'll write it down. I always have a little piece of paper, and I write it down, and then I go get them to cut down time, because before what I was doing was filling up a cart of 15 waters, and most of them didn't even want it, or they couldn't have it anyway, so all of that was wasted. So I said, okay, you know what, while I'm in the room, let's get a routine down pat. So that's my routine. I do everything and assess everything while I'm in the room. I check the room while I'm in the room. Whoever, if it's a total care patient, make sure they have briefs and pads. Make sure they have, I have enough wash towels and cloths, so that when I do need to go and change, I don't have to keep leaving the room getting supplies. Everything's already there for me. But in the morning, what's important to remember is to take all of that stuff out of the room. Make sure there's no extra linen or anything in the room. What else? Okay, so after I give everyone what they need, It's AccuCheck time. This is something that we're not allowed to do at the nursing home. We're not allowed to do AccuChecks, but here in the hospital we are. So I test their sugar, those who need it. Sometimes I get 6 people who need AccuChecks. Sometimes it's only 2. There's a lot of people that are like on 3 or 4 people in isolation. So I usually do them last so that, you know, I don't have to keep putting on their gown. It's plastic, it's hot, so I do those rooms last if they need anything like AccuCheck their blood pressure. And that's another thing, the nurses, they will tell you what they need. So if they need like a blood pressure, I'll do that during that time. But blood pressures are done at 4 o'clock in the morning, and I do AccuChecks twice unless the nurse needs it or the patient wants it done. What else? So that's pretty much what I'm doing for a couple of hours, and then when that is done, if I don't have anything to do, I will go see if anyone needs help, my fellow CNAs, if they need help with anything, because at night we are responsible for washing our total care patients. So if they need help bathing anyone, I usually make myself available for that, and they make themselves available for that too. And that's another thing, working at the place that I'm working, with the people that I'm working with, I'm not sure how it is on other shifts, or the other shift, because there's only 2 shifts, everyone helps each other. Another thing that I noticed with the nurses, they don't have that superiority complex, Mr. Cat, about, you know, I'm better than you type attitude. They don't, it's there everywhere, but it's not the majority of people. You get 1 or 2 people that act that way, as opposed to the whole entire staff acting like that way, you know, at the nursing home. At the nursing home that I was working at, I'm talking fast, I'm sorry, but I'm trying to cut it down to 10 minutes. At the nursing home that I was working at, there were some people, especially when I first came, that had that type of mentality, and that was that aura that was there. And it kind of made me feel a little uncomfortable, a little discouraged, but I still pressed on because I know that I'm not there for them. I'm there for the, you know, the patients, the residents, so they can, if they feel that they need to feel important by putting other people down, talking to people like they're trashed, and let them go ahead with themselves, because what goes around comes around. And I'm sure doctors treat them like crap too. So there's a universal law, the Bible calls it sowing and reaping. You reap what you sow. So if you treat people bad, people are going to treat you bad. So that's why I make sure I don't do that to people. When I become a nurse, I will not look down on anyone. I don't care what they do. Maintenance, little candy stripe little girls that walk around, I will never do that to anyone, because I know how it feels for someone to do it to me. So that whole, you know, atmosphere of I'm better than you type thing is not in the air. Everyone is friendly. They go out to eat, nurses and CNA. They have relationships with each other, you know? So it's just, that is not there, which I'm happy that I'm working a shift where these people are friendly and they don't have that mentality. And another thing is the call light system is different. Everyone answers call lights. It's not just the CNAs. We have this little phone, like I was telling you guys. I'm not sure if I'm telling you. I told you about the phone. I mean, this is my second time making this video, but we have these little phones, and most of the time the patients will call the desk. In the desk, they will call whoever it is they need to call to attend to the patient. Most of the time, the patients only want the nurses because they have the handy, right? So, yeah. That's the only difference, and we all answer lights. Everyone does everything. It's not like if a nurse goes in the room and they see that the patient needs help to go to the bathroom, they're not going to say, okay, well, hold on, wait a minute, I'll go get the CNA. You know, that's what they do in the hospital. They will not put somebody on the toilet, most nurses. You know, they'll just make them wait and hunt us down. And we can be God knows where. And they'll find a CNA to do it. They won't do it. Here at the hospital, nurses, they do everything. We all help each other out. That's the only difference of what I'm seeing. Because that's why I was shocked when I saw that. When I said, oh, no, you go ahead, I got this. I'm like, if I was a nursing home, no, this nurse wouldn't have got it. I would have to stop what I'm doing, hands loaded and all, to come attend to this person, you know, and they're very considerate, and they understand, because most of the nurses that work at the hospital were CNAs, so they get it, you know, and like people say, everyone says this, the best nurses are those who were CNAs. I don't know, but from what I'm seeing, I see that maybe there is some truth to that. Okay, what else? I think that's about it. I don't know what else to tell you. The only difference, everything is charted. Everything that we do, every little thing must be charted, and our charts are done on the computer system instead of in a ADL book. In the nursing home, we had a book and we wrote little things down in its proper place. We don't chart as much as the hospital charts. In the hospital, we have to chart everything we did. If we gave them a blanket, we have to put that in. If we changed their gown, we have to put that in. Every little thing has to be charted. Charting, that takes a lot of time. So we do have to have, so on our downtime, we're just charting. So we're always doing something. We're always doing something. If we're not taking care of a patient, we're charting, because all those 15 people that we have been doing things for, everything that we did for them has to be charted. I think that's about it. I'm not sure what my time is, but if you have any questions, please let me know. I'll be happy to answer them. I think that's the only difference. Less pain on the body, and less stress. Is not as much stress. Everyone shares the responsibility where I'm working, and it's just easier. Put it that way, it's easier. Now I understand why people are dying, CNAs are dying to get into a hospital, because it's much, much easier. Okay, so with that, I'll talk to you guys later. Bye.